A lot of pregnant mothers have anxiety about feeding their baby, especially when it's your first because you've never done it before and you want it to go well. Breastfeeding is so beneficial for you and your baby, and when you come to the hospital, we want to do whatever we can to help you be successful at it. As soon as your baby's born, as long as both you and the baby are doing well, we encourage skin to skin. And that's where we just put a diaper and a hat on the baby and stick their little bare chest on your bare chest and cover you both up. And this does so many amazing things for them, one of which is helping to prime their body for breastfeeding. We also try to initiate that first breastfeeding experience during the first hour when the baby is really alert and more receptive to it. And the earlier you initiate it, generally speaking, the more successful you are and the longer you're able to breastfeed. In the beginning, your body is just making colostrum, and in the hospital we call that liquid gold because there's not much of it, but it is packed with a punch. It's full of antibodies, fat, and protein, and it primes the baby's gut for breast milk to come. It's amazing that your body knows what your baby needs. You need to breastfeed your baby every 2 to 3 hours or on demand if they're wanting it more frequently than that to stimulate your body to make breast milk and also to get your baby that very important colostrum that comes before the breast milk. While you're in the hospital, we encourage you to keep your baby with you as much as possible. Of course, your baby loves to be with you most, and your baby actually knows your sound and your smell, and they'll be happier when they're with you, but it's also an opportunity for you to get to know your baby and their feeding cues so that when you go home, you feel comfortable in taking care of them and nursing them. Another important thing to keep in mind is that breastfeeding may be natural, but that certainly doesn't mean that it comes naturally. It's going to take work and effort, and again, the staff at the hospital is committed to helping you. We have lactation specialists and your nurses around you the entire time to help you when you have questions. One of your questions might be related to pain. Breastfeeding should not be painful after the initial latch, and so if you're having pain, talk with your nurse or a lactation specialist and they can work with you one-on-one to see what adjustments need to be made so your baby's latching properly, getting the milk that he or she needs, and that you're not feeling pain as a consequence of a bad latch. And one last tip. Unless it's medically indicated, delay the introduction of bottles for at least 2 weeks, and if possible, go even longer because sometimes babies get a little bit lazy and don't suck as well at the breast if they get used to the bottle. Good luck with everything, and if you have more questions for me in the future, please feel free to ask them on our Facebook page at facebook.com/InnerMountainMoms and recommend us to your friends and family too.